At one point, there were 100,000 COVID vaccine doses sitting in cold storage in Idaho, waiting to be used, just sitting there, while thousands of Idahoans were frustrated with not being able to gain access to them. That point was last week. Well, since then, good news is we've made some progress. Today, we learned Idaho is up from being ranked 44th in the nation to 27th in terms of percentage of vaccines put in arms from the state's allocations. The state is now tracking that information live for everyone to see. And Joe Paris joins us to show us a new tool that they're implementing. He also has an answer for those of you that are trying to figure out where and how to get a vaccine. Joe?
Well, recently, Brian, Governor Brad Little had talked about the process of the vaccine rollout, saying that there does need to be more transparency on how the state of Idaho is doing with getting the vaccines distributed and administered. Now, critics of the Idaho rollout have said that the whole thing has been too slow and that they're simply just not getting enough shots in arms. Others have said that the limited supply of the vaccine has just bottlenecked the entire process. So even if Idaho was doing a good job, they only had so much to work with. Now, a lot of people, to be frank, have been talking about different parts of the rollout without the data. And that's why when the data became available, the state of Idaho is now publishing it online. It took a little time to get this together, but I want to show you this new website that's actually right on the front page of the Idaho COVID website. It's a data page, and it really tracks how many vaccine doses are being distributed to every provider and then how many doses that provider has been given. So you can get a percentage, a conversion rate there. Now, the data is broken down, as you can see here, at the health district level as well as the individual providers within it. For now, the data will be updated 3 times a week to give a snapshot of supply and use down to each vaccine. And when the tool comes in, it also comes in with new insights. As Brian mentioned, Idaho saw a large improvement in terms of vaccine dose usage from a week ago. We reported to you that about 55% of the vaccine supply had been used last week. That is now up to 71% total. Health and Welfare Director Dave Jepson points to an even more impressive piece of data, the use of the first dose allotments.
As of today, 91%, I'll say that again, 91% of first doses received in Idaho have been administered, which means there's less than 1 week's worth of inventory in the state right now. So the providers are doing a great job of getting those first doses out within 7 days, which is our goal.
And Jepson also reports that the rollout is going well for those second doses as well. He says for the most part, people are coming in and getting their second dose on time. Those doses come in about a week before they're supposed to be administered. As we've reported, one shot, you take it 3 weeks later, one 4 weeks later. So this is great information. Idaho has 20,000 extra doses coming in for that second dose a week. They're getting 25,000 first doses a week, so about 45,000 doses a week coming into Idaho, and soon a federal program with the pharmacies is going to give Idaho another 5,000 a week. You may be sitting at home saying, well, how do I go and get one? A few weeks ago, we were talking to you about the PrepMod tool that the state of Idaho was working on, and this was a registration tool and a vaccine location finder tool. I spoke actually with many of our viewers about it who told me they were excited about it. Well, the state of Idaho decided that it was redundant at this point to have that tool because of the way providers were working on things as well as the health district. So for now, the PrepMod tool is not going to exist here in Idaho. The advice is to get in touch with your primary health care provider or your local public health director. The Idaho Department of Health and Welfare has this advice for you as well.
We'll keep looking at tools as they become available and see if there's something that we can potentially stand up over time. But for now, we didn't want there to be then 8 different ways of folks getting on lists and trying to find vaccine locations. So we're directing them to their local public health districts.
So again, reach out to your public health district, which has all of its information posted on the Idaho COVID webpage. We're going to link to that for you in this story on ktvb.com, or try to work with who you usually do your medical practice through. So another thing that it came up recently is that there are a growing list of providers here in Idaho that are actually administering the vaccine. The Department of Health and Welfare reports that they have about 400 providers signed up right now, with about 50 more that are in the registration progress to really have more places to go get the vaccine. A question has been asked, though, with Idaho having such a limited amount of vaccine available, is having so many different providers really just spreading the supply thin and not helping the problem? I asked that to the Department of Health and Welfare this afternoon. They tell me they are confident in how the rollout is going, and having more providers will provide more options down the road.
Making sure that we're getting it out as quickly as possible, but also as equitably as possible. And so having a wide variety of enrolled providers, I think, is very valuable, because then we have opportunities to get vaccines to the places where people are. We know that not everybody can come to a large, high throughput event in an urban area, and we need to be able to take some of those vaccines out to local areas.
So, Brian, in terms of a federal supply, things are still pretty limited. Again, Idaho getting about 25,000 first doses a week, and then whatever is needed for those secondary dose allotments. I am told, however, though, that those second doses are not having to be sacrificed to use on first doses. So that is the good news. We're seeing an improvement here in Idaho, Brian, but we'll continue to see if that federal, I guess, allotment, as they call it, will be increased in the coming weeks from the Biden administration.
And with the increasing providers here in Idaho, at least it'll give us a few more channels to where we can maybe find those vaccines once they become available. All right, thank you very much, Joe.